having a baby completely changed my relationship to health. I had a really tough pregnancy from beginning to end. My first trimester was so much harder than anyone had ever told me. I was exhausted and nauseated every single day for 19 weeks. I developed really chronic pain in my hip pelvis area, and I was diagnosed with this condition called SPD, which is pubis symphysis dysfunction. And it turns out that 1 in 5 pregnant women experience this condition that is debilitating, and for many women, you cannot walk in your pregnancy and you have to be wheeled around. It literally feels like your legs are disconnecting from their sockets. Even rolling over in bed is excruciating. Getting out of bed to go to the bathroom is something you can no longer do by yourself. So I felt really dependent in a way that was really hard for me psychologically and emotionally, and it was just a very vulnerable time, all for this child that I didn't plan for, frankly. It was so much change all at once, and really, really so much harder than I thought pregnancy would be. But thank God for me, I had the most beautiful birth experience out of hospital with a team of Black midwives that made me feel so safe. My husband ended up being my doula. I call him my dad doula. And we brought this baby into the world in such a sacred way. I was truly on a high, on a natural high when I gave birth. And I haven't come down. It's been a year and 3 months, and I am still on a high. I'm in love with my baby, and I feel so supported. I have not let my midwives go. They're like my aunties. I invite them over all the time. They came to the baby's first birthday party. They're a part of my tribe forever. I think that I was aware of the Black maternal mortality crisis in a peripheral sense. As maybe a survival tactic, I tried to insulate myself from that awareness because I didn't want to bring that fear into my birthing experience. And I also think that I naively believed that my privilege would insulate me in some way from those negative outcomes that you hear about, those deadly outcomes that you hear about. Black women are dying 3 to 4 times more than white women. And that stat is inclusive of every socioeconomic status. It doesn't matter how much money you make. It doesn't matter what school you went to. It doesn't matter who you know. You can very well become a statistic. I became pregnant shortly after I moved to LA in the pandemic, so I didn't have a doctor, let alone an OB. No one was going to the doctor during the pandemic unless, God forbid, you had a really serious case of COVID or some other health crisis. So I thought, how hard is it gonna be to find an OB? How hard could it be to have a healthy baby in this country? It's pretty hard. I went to see doctor after doctor, and I had awful experiences. I had doctors that straight up gaslit me, that absolutely did not want to hear my questions, didn't want to entertain any of my curiosities. I had issues with negligence, gross negligence. What I knew after going to 8 different doctors is that this is not a system that is set up for me. I was so grateful to have my eyes really opened to the world of midwifery care. They came into my life and they just made me feel so safe, so seen, not like a statistic. They cared about my holistic health. They asked about my marriage, how I was feeling in general, and they would spend hours with me if I needed it, which is night and day from what you experience in a hospital. You get 15 minutes if you're lucky with a doctor. There isn't just one way to have a healthy baby in this country. If anyone is making you feel that you have to stick to this model of maternal health that isn't working for you, they're lying to you. There's more to know, there's more to explore. Now part of my work is to make sure that the next generation of moms aren't going to this as blind as we were and as naive as I was. I went from hearing about the Black maternal mortality crisis through the lens of statistics to understanding it in a first-person way. where I was experiencing the failures of our medical system up close and personal in my lived experience, even as a Black woman with all of the privileges you could have in this country. It did not separate me from those statistics. And I hope that we are reframing this conversation for this next generation of women through the lens of hope, through the lens of options and agency, and like a safe, sacred, beautiful birthing experience is what we deserve.